I've been coming up hot for a minute. Everybody know the drop when I'm in it. Drop the top when I'm in it. Everybody know the drop when I'm in it. Yeah, I flow so good. Everybody know you know when they click through. Tradition is about to be a show, be fun.
Hello everyone, I'm Dr. Reed and I'd like to welcome you to our second online event today. And I'd also like to thank all of our patients for entrusting us with your aesthetic needs here at Nani Aesthetic Medicine. We have some main priorities here, and our first priority of course is your safety. And so we check temperatures when people come in the door. We use the masks and other personal protective equipment while you're here. And of course, we're also concerned about the safety of our procedures. And that's one of the reasons why we've invested in ultrasound machines, so that we can make sure that, you know, that we guide the injectables and things like that into just the right place, and so that you're perfectly safe. Also, we invest in the continuing education of our talented staff here. So we want you to know that you're safe, and that's our number one priority. Our second priority is optimal results. And that's why we don't just kind of offer you do this or you do that, but we approach each patient from the whole aspect, so that we'll use a combination of this and that, so that we can get the best results that work for you. And then the third priority, of course, is maintaining customer satisfaction, and we're very proud of the fact that we have a high patient retention rate here. So I'd like to thank you for attending and being part of this event today, and to help you, our valuable patients, get ready for the holidays. We're going to offer incredible pricing for you during this event, and watch the various demonstrations that we're going to do today, and then make sure you call our office and set up your appointment, because these special prices will apply from today, 8:30 a.m. Today, October 14th, 8:30 a.m. through to tomorrow before midnight, and then they're gone. So make sure you sit back, relax, watch the demonstrations, and then call, so that you can take advantage of these excellent prices.
So it's been 4 months since we last treated Heather. Botox in general lasts 3 to 4 months. So it's about time. Today we're going to be using Xeomin, which is a pure form of Botox. Everyone that tried it loves it. And I love it. Miana loves it too. And this is going to be a first time for Heather to use Xeomin. So the main difference of Xeomin versus the other neuromodulators out there is that it has no protein in it. Okay, so what you're receiving is a pure form, I would say the good tox. Okay, but just like Botox, it lasts just the same, it works just the same. Okay, so we'll be concentrating on the upper face of Heather. Can I see? Raise your brows for me. Okay, and frown for me, and smile. Okay, so we're gonna working on her frontalis, the forehead. Frown, nobody likes their frown, right? And then lastly with the crow's feet. So it's a quick procedure, under 10 minutes, your beauty regain. Okay, alrighty. So as I inject, I ask patient to make some facial expressions for me, so that we can precisely target the muscle. Her face is already clean, but I still double clean because we are OC like that. Raise your brow as high as you can. Alrighty. So just tiny pokes. How does it feel?
I can't feel it at all.
Okay, good. One more. Raise again. Alright, perfect. One more time for me. So when it comes to doing Botox, important not to do any exercise for the next 24 hours. And it's easy. I always tell my patient with Boost Ice Pack, no lying down for the next 4 hours. And then what else? That's about it actually. One last raised brow for me. This movement there. Alrighty. Okie dokie. Get mad to me. There you go. So, frown again. One more time. Alrighty. Oops. Frown again for me. Okay. Okay. Again. Alright. Alright, we're done there. So for first-time patients, we want them to come back in 2 weeks so that we have something on record. That's when we will do our final assessment. For maintenance, I want my patients to do this every 3 months, okay? Quick treatment, you can come in with your mask on, especially if we're just treating the upper face.
You'll notice that before Marie starts to inject the fillers, she's using an ultrasound so that she can figure out exactly where the arteries are, because we don't want to inject any filler into an artery, obviously. Now, if that ever does happen, then we use the ultrasound to find the artery so that we can put the dissolving material, the enzyme that dissolves the filler, right into the place where it's needed. Also, sometimes we have patients come in here and they've been to other places where they didn't do such a good job with the fillers, and they just want the fillers dissolved, and so we use the ultrasound then sometimes just to locate exactly where to put the dissolving enzyme so that we can get a much better result. So Marie's just going to be injecting some filler into the preauricular area, and she doesn't need much. She did use some lidocaine first, just to numb the area, and then we're using a cannula, flexible cannula, and that maintains a certain amount of safety as well, as far as piercing blood vessels. It reduces the risk of piercing blood vessels. And she's using RHA3. Yeah? There's 2, there's 3, there's 4, and they get progressively thicker as you go up. So this is kind of the mid-range. We're pretty ideal for this area.
Any kind of filler is, of course, it draws water. You don't want to overfill the area. The goal here is just to minimize the appearance of that loss of volume in front of the ear. You're doing okay?
Mm-hmm.
Don't hurt at all?
Mm-mm.
Good. Inner pressure. Yeah, we're good. Okay, we're in. Little pressure. Keep the needle moving. And I don't really inject bolus. I'd rather just move, fan, thread. Better that way.
Very
You
good.
don't see the dip anymore, yeah?
It's much better.
I like it a lot. I can tell. Awesome.
Nice.
Yeah.
How was it?
Oh, okay, not bad.
Okay. Should be numb, okay? You're okay?
Just the pressure.
So you will hear it, okay? Which feels weird. At any time uncomfortable, you gotta let me know, okay?
Wow.
You see
Oh my
that?
God, it's gone.
Beautiful.
Okay, you okay? Any kind of discomfort, you're gonna let me know, okay?
Okay.
You will hear it. It will feel weird.
Mm-hmm.
You're a very good patient.
Nice
Are you
transition.
done already?
Yes.
Oh.
Yeah.
And look at from here to here. Right here. Then you massage it like a clay. Yeah, you shape it and everything. Okay. Little pressure there. No, no. Sting, 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 sting. Sting, 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 sting. Can you see? Lips I've given you.
Okay, I'm so excited. Wow!
Little swollen, but it will subside. Okay, but look at your pillow lips there.
Yes.
Smile. Yee, little swollen. Okay.
Okay.
First round. Okay.
Alright, so first step is to clean the face with face wash. I'm going to use a Nani. It's good for all skin types. The temperature is okay?
That's great, yeah.
Alcohol before the dermaplaning because the skin needs to be very clean and very dry. So this is the blade, sterile one-time use blade. Dermaplaning, we're using a sterile one-time use blade to get rid of the dead skin cells and the peach fuzz. Okay, and it's gonna make any facial or any other face treatment to work better, go deeper.
So the next procedure is what we call Trifecta Radiofrequency Microneeding. This is one of our top treatments here at Nani because it's really good for textural concerns, from acne scars, from wrinkles, from pore reduction. And this is a good complementary treatment that we do in between all the injectables. Earlier, Dr. Reed had his dermaplaning, and now we're ready to do the same procedure, same day. So that's the beauty of doing everything under one roof here at Nani. So there's some discomfort most of the time, especially first-time patients. We do numb them, but overall it's a well-tolerated procedure. We are creating micro-injuries, as we say, that tell the body, let's produce collagen, let's produce elastin. The needles that are integrated into this machine are tinier than the Botox needle. So you are feeling the heat more than anything. And that heat is actually the radio frequency, that's being delivered straight to the dermal layer. For first-time patient, we want to do it minimum 4 series so that we can get the benefit out of it, especially for people that never had a treatment done. So there's slight redness, will go away. The most important thing when you're doing all this treatment is sun protection, okay? So by the way, I mentioned sun protection. Nani has its own brand of sunscreen. You got a tinted and also the clear, okay? And that will be part of our promotion for today and tomorrow. This one just helps accelerate healing of the skin, also helps collagen renewal. Remember, we created micro channels, so now we are introducing it straight to the dermal layer. You notice that there is no blood involved whenever we do the Trifecta Radiofrequency Microneeding. It's because the heat helps coagulate the blood. So this is a bloodless procedure. Alright, so we're doing a Pico 4 laser treatment for our patient here. We're just going to do a little bit of facial toning, and we're going to use Pico 4. Pico 4 is our favorite laser treatment here, especially if we're dealing with issues of hyperpigmentation, sunspots, melasma. Even for tattoos, this is also our go-to laser. Okay, so our patient's face is already clean and we're ready for the procedure. We're wearing protective goggles as well as the patient because this is invisible laser. You will hear popping sound, but not as bad. Little discomfort. It's really more like rubber band snaps, but there's no significant social downtime to this procedure. What I'd like the patient to do after is, of course, commit to a good skin care. I have full control what happens here. I have no control of the patient's lifestyle. Most important of all is sun protection, sunscreen use, which you should do, right?
Yes, I
Alrighty, so it's about to start. Okay.
Yep.
Not bad, right?
Nope.
Okay, because this is a different setting that I did for him. Okay, this is the real thing now.
That's exactly like rubber bands.
Yes. First time patient, again, depending on the issue, minimum 4 treatments spaced out 4 weeks apart. Your skin might feel a little drier than usual, so you just moisturize heavily, okay?
So it'll be good for that spot I have on my right side.
Yeah. So on a scale of 1 to 10, 1 least painful, 10 most painful, how do you rate it?
1 to 2.
1 to 2, not bad. Whenever we work around the mouth area, if you have history of cold sore, I always tell my patient, my trigger, okay? It's a quick fix, Abriva or Arnica. And for the next time you come, you can pre-medicate, you can ask your primary care doctor to prescribe you antiviral. So what this laser is doing is breaking the pigment, and the body will dispose pigment, okay?